Welcome to Schlock Talk. Thanks for joining us again. My name is Anthony Schlock. I'm going to be your host for today. I am joined by the one, the only Van Shil Shaw, a physical therapy student. Van is here today because he has, he's a little bit of a negative Nancy, let's say.
Just a little bit.
Just a little bit. And he has, he wants to talk about some of the cons with our bill, the Medicare Patient Choice Act. And I'm a little bit more of an optimist, so I'm going to talk about the pros. Let's get into it. So Van, what would be the first con you wanted to mention?
Well, the first con that I want to mention is, if this bill passes, there's going to be increased out-of-pocket costs. So, if a provider doesn't accept, the patient pays 100% of whatever gets billed. That's the first one that I want to say.
Okay, and that's valid. But I would kind of counter that with you have a greater choice of provider as a patient. So patients can continue seeing a trusted PT even after becoming, eligible for Medicare, and they're not forced to switch just because of insurance status.
Oh, that makes sense. Yeah. And the second con was the patients must understand whether the provider is opting in or out. Some patients won't know that unless they actually ask for it. And then patients don't know what they're financially responsible for. Mm-hmm. So there's confusion between what the patient pays and what the provider pays.
Okay. All right. Well, a couple more pros, although those are valid cons. The patient's going to have access to non-covered services, so they're going to be able to receive, wellness care, performance training, higher frequency visits, which Medicare typically doesn't allow. And it's going to be, that's beneficial for, active older adults. Also, there's a potential for more personalized care. So cash-based settings often allow longer sessions, one-on-one care, which is hard to come by sometimes, and less documentation-driven treatment.
And then there's a higher risk of access for with inequality. Mm-hmm. So higher income patients benefit more from if a clinic accepts cash or a hospital accepts cash, there's more flexibility with that payment system. But lower income patients may feel only limited to Medicare only providers. So the access is very limited depending on how much your family earns.
Fair. But the kind of pro side of that is you have a continuity of care. So there's going to be no disruption when you're getting to that Medicare age, that 65 plus, and you're going to be able to maintain a long-term therapeutic relationship with your PT as a patient. But enough about the patients. I think we kind of covered that. I'm going to get into some of the pros that it's going to, some of the pros for the private practice PTs that this is really going to affect.
Okay.
So the business model flexibility. You're going to have the ability to run cash-based or hybrid practices and set pricing, independent of Medicare.
Yeah.
Pretty cool.
Of course, but it's a big financial risk, Mm-hmm. It's if you opt out of Medicare, you lose a big access of the Medicare patient base. Mm-hmm. And also the revenue which yearly comes in with your private practice, it is very dependent on your patient's ability to pay. So if you can't pay, you're not going to get your revenue, and your patient fees too small.
Potentially, but you also have a reduced administrative burden. There's no Medicare documentation requirements anymore. Woohoo. Billing restrictions are not going to be as prevalent, and coding constraints. These are all stuff that private practice PTs are constantly being challenged with. So essentially, more time treating, less time charting.
I understand that, but at the same time, it's you also might have some communication challenges. So your private practice, you're gonna have to explain to the patient why they're paying out of pocket or cash, whereas Medicare or insurance base, they cover most of it or some of it.
Yeah.
And due to those conversations, it might create uncomfortableness between you and the patient.
Fair enough. Well, I have to mention though, the clinical autonomy is going to be really big, really important for private practice PT. So you're going to have the freedom to choose visit frequency, use interventions not typically reimbursed, and avoid the checkbox care. Yeah.
Okay.
Yeah. Any other cons you wanted to mention? I got one more pro. All right, we're back. Sorry for the brief commercial break. Van, you were talking about your last con you wanted to mention.
Yeah, before that break, I was talking about how, if you opt into this bill, you might have some legal and contractual complexities that you might figure out. So if you opt in, providers, private practice, you're gonna have to enter some formal private contracts. And once you enter those contracts, it's gonna be really difficult for you as a private practice person to get legally opted out of that contract. And that might, in the long run, it might be detrimental to your own practice and your profession.
Yeah, and that's a fair point. However, I see kind of the a positive of that is you're going to be able to patient retention is going to be higher. So as they age into Medicare, they're going to be able to continue with higher level care that you could provide. So here, just kind of let's kind of sum it up, an honest take, right? So this bill doesn't magically fix anything. It just shifts the system. It's going to shift it towards freedom and flexibility, and away from the standardization and financial protection. Whether that's good, that really depends on the patient's financial situation and the clinic's own business model. And so I think as the listener, you just gotta consider both viewpoints and make your own decisions. Yeah. Well, thanks for joining us for today at Schlock Talk. Van, why don't you let them know where they can find you?
Yeah, so I have an Instagram account. It's called PT_advocacy. And Anthony Schlock's account is PT_advocacy1.
Yep. So follow us there. Thanks for joining us.